Good day, College of Nursing. I am Francis Nicole M. Llamas. Together with me is Krisha Ann MondegaSung, Kyun NaCris and Naciongayo, and Tisha Alyanna Perocho. We are from BSN 3B Group 3A, and our study is entitled Lived Experience of Individuals with Intestinal Ostomy. The purpose of our study is to delve into the first-hand experiences of individuals who have undergone intestinal ostomy procedures. For our research design, the qualitative research and phenomenological approach look for more profound than the surface meanings of the phenomenon, which is the struggles experienced by individuals with intestinal ostomy. We have gathered 5 participants living with intestinal ostomy. The inclusion criteria are participants were aged 30 and above, including both males and females, living within Negros Occidental and had been diagnosed with intestinal ostomy for a period exceeding 3 months. For our research instruments, we gathered the data using in-depth interview. The interview guide that contained the demographic profile of the participants. The primary question centered on the participants' experiences in terms of how they manage their lives with an intestinal ostomy. There were also probing questions that further explored the challenges they face.
For the results and discussion, the first theme is attachment subsystem. The participants emphasized the unconditional love and increased affection they received from their family and friends after undergoing ostomy surgery. Many participants highlighted how their family support intensified despite the added responsibilities that came with their condition. While acknowledging the consideration from their family, some participants also noted the financial burden their condition imposed. Despite this challenge, they appreciated the emotional and practical support they received from their loved one.
For the second theme, we have the aggressive subsystem. This theme explores the interplay between assertive behaviors and coping mechanisms in individuals with ostomies. Here, we identify 2 interconnected subthemes: initial response to ostomy and financing the ostomy. The initial response to ostomy surgery includes a range of emotional reactions, from resistance and disbelief to eventual acceptance. For resistant, participants often initially resisted the idea of undergoing ostomy surgery. They struggled with accepting the necessity of the procedure but ultimately agreed, recognizing it as essential for their health. For disbelief, some participants found it hard to accept the diagnosis and the need for an ostomy, especially those who believed they had a healthy lifestyle. For the second subtheme, we have financing the ostomy. Some considered it as burdened. Financial challenges emerged as a significant concern for participants managing ostomies. The ongoing expenses for ostomy care, including maintenance and colostomy bags, place a strain on financial resources. Some also considered it as struggling. Many participants relied on support from family members to cover costs, recognizing the burden it placed on their loved ones. For the third theme, we have the ingestive subsystem. This theme was explored how having an ostomy affected the feeding practices of the participants. First is we have unrestricted. Some participants reported having no restrictions when it comes to foods. However, their appetite has decreased due to their situation. Next is exclusionary. Many participants have to follow a restrictive diet. They avoid favorites and limit themselves to certain foods like fish, which must be boiled or grilled. Pork, chicken, and oily foods are also completely avoided. Next is nutritionally aware. Participants are highly conscious of their nutritional intake. They avoid sweets and greatly reduce their consumption of meat, particularly beef and red meat. Preference is also given to lean pork in grilled dishes or cut back. They also prioritize vegetables and fish as much as possible.
And the last theme 4, which is the self-care deficit. Participant statements underscore the significant impact of ostomies on their ability to carry out daily activities. Findings highlight the importance of comprehensive support systems that addresses the diverse needs of individuals with ostomies, encompassing both practical assistance and emotional support. Some underscores the prohibited actions due to health risks, noting that he can no longer lift heavy objects. Another discusses the major change in his ability to carry weight, where even small tasks feel burdensome. Some shares the discomfort experienced on certain days, dealing with the weight and pain of carrying a colostomy bag, and also describes the unpredictability of managing his condition, with frequent and unexpected discharges requiring constant attention. Further emphasizes the financial burden and need for support. highlighting the economic strain of managing the condition and its impact on previous activities, such as singing in the church choir. These narratives collectively portray the profound impact of health conditions on physical abilities, comfort, predictability of daily routines, and financial stability.
We will now proceed to conclusion. All participants reported strong support from family and friends, with no significant impact on their social lives due to ostomy, underscoring the importance of supportive relationships in managing chronic illness. Emotional responses varied from initial resistance to eventual acceptance, demonstrating resilience despite initial despair. Financial challenges were significant, with ongoing expenses straining resources, often requiring family support. Physical limitations, including dietary restrictions and daily activity challenges, were common. Despite these obstacles, participants showed determination and resourcefulness. Incorporating comprehensive ostomy care education into nursing curricula significantly enhances student nurses' ability to provide tailored and holistic care, addressing the unique needs of ostomy patients and ensuring higher standards of patient care in hospital settings. Now, finally, for a recommendation, the study highlights the multifaceted challenges faced by the patients with intestinal ostomies and provides comprehensive recommendations for various stakeholders to improve care and support. Nurses are urged to offer holistic, tailored care that addresses both physical and emotional needs, while mental health professionals should develop treatment sensitive to the unique psychological impacts on these patients. Participants should be empowered with knowledge and robust social networks to enhance their autonomy and resilience. Caretakers need to refine their care strategies to better support their loved ones, and family members should educate themselves to provide emotional support and reduce stigma. Student nurses must deepen their understanding of ostomy care, and manufacturers should focus on affordable, effective products. And lastly, the future researchers should explore additional variables and include larger sample sizes to expand the understanding of living with an ostomy.
So that ends our presentation. Thank you so much for listening.